Hi, this is Dr. Rahul Pandit. I am the Chair of Critical Care and Emergency at Reliance Foundation Hospital and all Reliance Healthcare initiatives. And I'm here to talk about the World Heart Day, which is coming very soon. And ICU being an integral part of managing these patients, I thought I could bring across some crucial messages for you so that it will actually benefit all of you as common men and citizens to improve your overall health and also help you to understand what is done in intensive care so that some of the myths, some of the question marks which are there of when your loved one is in the ICU would get answered by this. The most important question which comes to mind is that my patient is admitted to a ICU and the cardiologist is looking after, but there are ICU doctors who are there. Now, intensive care is actually a very young specialty. And if you look at intensive care for the last 15 to 20 years, it has really boomed in India, but across the world, it's a very well recognized specialty for almost last 2 or 3 decades. Now, what happens is when your patient comes to ICU, they require continuous monitoring. They require minute-to-minute updates of what is happening with their blood pressure, with their oxygen saturation, with their ECG rhythms. And the intensive care doctor is trained to actually manage these problems. So in coordination with their own doctors as well as in coordination with your cardiologist, they would have a treatment plan which would be executed for the day. So the cardiologist may come and visit, but the execution will have to be a continuous process. A lot of times cardiac team also comes and helps out the intensive care people, intensive care doctors to execute the plan which has been discussed with the cardiologist and the intensive care team. But it's always a team approach. You cannot have one specialty now looking after you all along, especially when you're critically ill, when you require actually to be in the ICU. So ICU has now changed from a solo person giving therapy to actually a multimodal team, which is a multi-speciality team, which will look after, where the intensive care becomes the center pillar of supporting you while you are in ICU. Once you are gone out of ICU, back to the room or back to the wards, then it really is a problem which is specifically to deal with the heart, which the cardiologist will be able to manage more often than not by themselves. So I think this myth needs to be cleared off, that what are these doctors doing in the ICU? These are the doctors who actually look after you 24/7, who are the ones who are taking immediate actions for the change in your physiology, and who are coordinating with your cardiologist and the intensive care specialist to give you the best possible care.